Welcome to our channel. Today we're tackling an important topic, dengue. This is a viral disease that has made its mark worldwide, particularly in tropical and subtropical regions. Understanding its origin, symptoms, and prevention is vital to safeguarding our health. We're talking about a disease that can range from mild to severe, and in some cases can even be life-threatening. It's time to pull back the curtain on dengue to empower ourselves with knowledge and proactive measures. Now, let's delve deeper into the origin of dengue. Dengue is a viral disease transmitted by the Aedes aegypti mosquito. This uninvited guest, the dengue virus, has its roots in the tropical and subtropical regions of Asia and Africa. Over the centuries, it has managed to hitch a ride with humans and mosquitoes, spreading its influence far and wide. In the early days, the virus was primarily an issue for monkeys in the jungle, but as we encroached on their territory, it found a new host in us. With our penchant for travel and trade, we unwittingly became the perfect vehicle for this virus to see the world. The dengue virus made its grand entrance into the Americas in the late 18th century and has since spread to every corner of the globe. Today, it is considered a leading cause of illness and death in the tropics and subtropics. Now that we've understood its origins, let's take a look at its primary transmitter. The Aedes aegypti mosquito is the main vector of dengue. This mosquito breeds in stagnant water, making it common in places like plant pots, discarded tires, and water storage containers. It's during this breeding process that the dengue virus is passed on to the mosquito's eggs, creating a new generation of dengue-carrying pests. Understanding this life cycle is crucial in breaking the chain of transmission and controlling the spread of dengue. With the vector clear, let's move on to the different types of dengue. There are 4 types of dengue viruses, each with different symptoms and severity. Let's dive in. First up, we have dengue fever, or Dengue 1. This strain typically causes a high fever, rash, and muscle and joint pain. Next, we have Dengue 2, often associated with dengue hemorrhagic fever. This can be more severe, causing bleeding, blood plasma leakage, and low platelet count. Thirdly, there's Dengue 3, often linked with dengue shock syndrome. Symptoms include severe abdominal pain, rapid breathing, and even shock. Lastly, DN4, which can cause both dengue fever and dengue hemorrhagic fever. It's important to note that infection with one type doesn't provide immunity against the others. In fact, subsequent infections can be more severe due to a phenomenon called antibody-dependent enhancement. So being aware of these types and their symptoms can help in early detection and treatment. Now that we know the types, let's understand the symptoms in detail. Symptoms of dengue include high fever, muscle pain, headache, among others. It's like a terrible flu that just won't let up. The fever can climb as high as 104 degrees Fahrenheit and can last for up to 7 days. Alongside this, you might experience severe muscle and joint pain. It's not called breakbone fever for nothing. You might also notice a distinctive flat red rash that appears over most of your body. If you're really unlucky, you might suffer from nausea, vomiting, and a loss of appetite. In severe cases, these symptoms can escalate into dengue hemorrhagic fever, which can cause bleeding, blood plasma leakage, and low platelet count. And let's not forget about dengue shock syndrome, which results in dangerously low blood pressure. It's not a pleasant picture, is it? Understanding the symptoms is crucial, but so is knowing how to prevent it. The best way to prevent dengue is to eliminate the breeding grounds of the Aedes aegypti mosquito in our homes. This mosquito, the primary vector of dengue, thrives in stagnant water, often found in containers like tires, plant pots, and water tanks. It's important to regularly clean and empty these containers to disrupt the mosquito's life cycle. Yet, eliminating breeding grounds is just one part of a comprehensive prevention strategy. Personal protection measures are equally important. Wearing long-sleeved clothing and pants can reduce the risk of mosquito bites, especially during peak mosquito activity times, which are early in the morning and late in the afternoon. In addition, using mosquito repellents on exposed skin and clothing can provide an additional layer of protection. It's also a good idea to install screens on windows and doors to keep mosquitoes out of your home. For those living in or traveling to areas with a high incidence of dengue, vaccines may be available. These vaccines can help protect against the virus, but they're not a substitute for the preventative measures we've discussed. Lastly, community efforts can significantly help in controlling mosquito populations. Organize cleanup drives to remove potential mosquito breeding sites and educate others about the importance of dengue prevention. Prevention is the best cure, but if infected, here's what the treatment looks like. There's no specific treatment for dengue, just measures to alleviate the symptoms. It's more about managing discomfort and preventing further complications. Rest is crucial. Your body needs energy to fight off the virus. Don't underestimate the power of a good night's sleep. Hydration is another key factor. Dengue can cause high fever and sweating, which can lead to dehydration, so it's important to drink plenty of fluids. Over-the-counter pain relievers can help with muscle aches and fever, but avoid medicines with aspirin, as they can increase the risk of bleeding. If you're feeling nauseous, try eating light meals and avoid spicy or fatty foods. In severe cases, hospitalization may be necessary. Doctors will monitor your condition, provide intravenous fluids and pain relief, and if needed, blood transfusion. Remember, if you show any signs of dengue, seek medical help immediately. It's always better to be safe than sorry. Thank you for watching. Your understanding of dengue, its origins, symptoms, and prevention methods is a crucial step towards maintaining good health. If this video has been helpful, we encourage you to like and subscribe. Your comments are also welcome. Let's continue the conversation and learn from each other's experiences. Remember to stay tuned for our upcoming health and wellness posts. Until next time.